Okay, John, we have results from the assessments you completed, including the Beck Depression Inventory, Beck Hopelessness Scale, Beck Scale for Suicide Ideation, and the Beck Anxiety Inventory. I want to go through these assessments, your scores, and their implications. So before we discuss your specific scores from the assessments, I did want to gain some clarification surrounding a few of your responses. On one assessment, you endorsed the idea that you would kill yourself if you had the chance, but you also, on another assessment, endorsed the fact that you have no desire to kill yourself and that you would try to save your life in a life-threatening situation. Now, it's entirely common to have some overlap and differences in your assessments, especially when you're completing 4 at one time. I just really wanted to gain an understanding of your most authentic feelings in order to be on the same page as we move forward together, okay? Now, the first assessment you took was the Beck Depression Inventory, which aims to measure characteristics, attitudes, and symptoms of depression. On this assessment, you scored 32, putting you in the 99th percentile, which aligns with severe depression. Typically, anything above a score of 28 would lead us to a potential psychiatric evaluation and possible medication to help with your distress. And these are things that we can consider as we move forward together, okay? The next assessment that you completed was the Beck Hopelessness Scale, which aims to assess and measure your level of hopelessness. On this assessment, you scored 13, putting you in the 97th percentile, which indicates moderate levels of distress. Based on relevant long-term studies, a moderate score of 13 is associated with long-term risk, which requires us to focus on accelerated treatment and attention together throughout our therapeutic journey. Following the Beck Hopelessness Scale, you completed the Beck Scale for Suicide Ideation, which helps to evaluate the presence and intensity of suicidal thoughts. This assessment helps to guide what interventions we can put in place together to help you. And on this assessment, you scored a 2, which does demonstrate a low level of suicidal ideation, but it's important to know that any score above a 0 is something that needs to be focused on, which we can address together. Now, the final assessment you completed was the Beck Anxiety Inventory, which focuses on measuring symptoms of anxiety that are somewhat independent of depression. On this assessment, you scored an 18, putting you in the 95th percentile, which does indicate a moderate level of anxiety. Considering your score and the fact that you reported instances of difficulty breathing and an inability to relax on a daily basis on your assessment, it's very clear that your anxiety is having a significant impact on your daily life, which really highlights the need for us to explore treatment options and interventions together. So with all of this information, it is definitely clear that you have a significant amount of depression and anxiety that is impacting your everyday life. Moving forward, I think that we'll plan to work together with a combination of therapeutic interventions, along with potential potential medication management, to attempt to lower the scores from these assessments and overall lessen your distress levels.